Today topic of discussion is cerebrovascular accident or stroke. Who says that stroke, a clinical syndrome, consists of rapidly developing clinical signs of focal and global in nature. So, lasting greater than 24 hours. Who defined that cerebrovascular accident? Clinical syndrome consisting of rapidly developing clinical sign of focal and global in nature lasting greater than 24 hours. Highlight in more than 24 hours. Lot of sign and symptoms that manifested neurological neurologically, but they disappear less than 24 hours. Here we are using term rapidly developing. Stroke is also known as brain attack. Heart attack, we get death of heart tissue. Stroke is the same. It is a brain attack, which means part of brain died. So part of brain, because of it, larger than 24 hours. Okay, it causes death, brain death, brain attack. So here brain death, that this name is called as rapid changing. Rapid changing means brain attack. Then focal and global. Global means greater part of that brain are affected, maximum part, greater part. Loss of consciousness and a change in um, cognitions. So this one, uh, focal changes means one part of the brain. Okay, a few part of that brain only affected, less part of that brain. This global means maximum, large part of that brain will affected. Focal means less part of brain will affected. So less part of brain, muscles here move in that face and arms to be affected. So it affected speech, can also affected. So first one is here we are using acronym fast. uh, F stand for neuron that supplied that face has been lost. Neuron supplied to face lost, so drooping the face. Then arms, left side and right side arms affected. Then slurred speech. Here that language disorder that affected that person ability to communicate. So poor or absence of grammar. The T stand for time. Time is essential because we have to get on top of it quickly. So otherwise rapid development and deteriorate. So these are that symptoms we have for brain attack. Next, two type of stroke. Okay, so what are the clinical symptoms? It cluster or constellation of that symptoms. Okay, we have lot of symptoms. There are two type of stroke. One is ischemic causes, second one is hemorrhagic causes. What is ischemic stroke? Means block in a blood vessels. Okay, here blood vessels, plaquage in that blood vessels that is going to the brain. So hemorrhagic stroke means burst in blood vessels in the brain. This one affected ischemic stroke 80 to 85%. Here 15 to 20%. So stroke occur when the blood supply to a certain part of brain is reduced or interrupted. Without oxygen or nutrient from the blood, brain cell cannot function properly, evenly die. So stroke occur when blood supply to a certain part of brain is reduced or interrupted without oxygen and nutrient from the blood. Brain cell cannot function properly. Even it causes death. There are two types of stroke: ischemic stroke and ischemic stroke caused by blocked arteries, hemorrhagic caused by ruptured artery. This ischemic stroke happen when blood clot obstruct an artery. In some patients, the clot form locally inside the blood vessels that supply the brain. This occur when fat deposited, when fatty deposit in artery or cholesterol plaque rupture and trigger the blood clot. On the other hand, this clot may travel to the brain from elsewhere in the body. Most commonly, this happen in the patient with arterial fibrillations, a heart condition in which the heart does not pump properly. Blunt strychnine in that chamber. This facilitates that blood clot. The clot may then pass into bloodstream, get struck the small arteries of that brain and block them. Hemorrhagic stroke, on the other hand, occur when artery leak or ruptured. This can result from high blood pressure, overuse of blood thinner or anticoagulant drugs, or abnormal formation of blood vessels such as aneurysm and AVM, anterovenous malformation. So this hemorrhagic stroke occur on the other hands. What are the way it can occur? When that artery leak or rupture, this can result from blood pressure, high blood pressure, overuse of blood thinner, anticoagulant drugs, abnormal formation of blood vessels such as aneurysm and AVM. As a hemorrhage takes place, brain tissue located beyond the site of bleeding or deprived of blood supply. So hemorrhage takes place, brain tissue located beyond the site of bleeding or deprived of blood supply. Bleeding also induces contraction of blood vessels, narrowing them and thus further limiting blood flow. Bleeding also induced contraction of blood vessels, so narrowing them, further limiting blood flow. Next, stroke symptoms may include one or more of the followings: paralysis of muscles of the face, arms, legs, inability to smile, rise and arms are difficult to walking, slurred speech and inability to understand simple speech. Inability to understand simple speech. Then sudden and severe headache, vomiting, dizziness, reduced consciousness, vomiting, dizziness, then reduced consciousness. So these are the symptoms: paralysis of muscles, inability to smile, difficult to walk, raise the arm, slurred speech, reduced consciousness, vomiting, dizziness and reduced consciousness. Cerebral stroke is a medical emergency and required immediate attention. It is essential to determine if a stroke is ischemic or hemorrhagic before attempting treatment. This is because sudden drugs used for treatment of ischemic stroke, such as blood thinner, may critically aggravate bleeding in hemorrhage stroke. So ischemic means we can use aspirin, but hemorrhage stroke not recommended. The ischemic stroke emergency treatment aim to restore blood flow by removing blood clot. Medication such as aspirin and TPA, tissue plasmogen activator, are usually first options. The TPA may be given intravenously. We want to give intravenous, or in the case of symptoms have advanced stage, means delivered directly to the brain via catheter insert through a artery at the groin. Then a blood clot may be also removed mechanically by special device delivered through the catheter. So emergency treatment for hemorrhagic stroke, on the other hand, aim to stop bleeding, reduce the blood pressure, and prevent vasospasm and seizures. These goals are usually achieved by a variety of drugs. If the bleeding is significant, surgery may be required to drain the blood or and reduced intracranial pressure. So surgery is required to drain the blood and intracranial pressure. Then preventive and treatment method: removal of cholesterol plaques in cataract enterectomy, arteries that supply the brain. So removal of cholesterol plaque by using method name is called as cataract enterectomy. Then widening of narrow carotid arteries. What are the method we can use? Whether ballooning and sometimes a stent also using. This is usually done with a catheter inserted at the groin. Various procedures to prevent rupturing the brain aneurysm, such as clipping and embolism. இந்த வீடியோவில் செரிப்ரோ வாஸ்குலார் ஆக்சிடெண்ட் ஆர் ஸ்ட்ரோக்கை பற்றி பார்த்துருக்கோம். சம் பார்ட் ஆஃப் த பிரெயின் பிளட் சப்ளை ஆகாது, அதுக்கு பேர் வந்து ஸ்ட்ரோக். டூ டைப் ஆஃப் ஸ்ட்ரோக், ஒன் இஸ் இஸ்கெமிக் அண்ட் அனதர் ஒன் இஸ் ஹெமரேஜிக். இஸ்கெமிக்னா பிளட் கிளாட் ஆகும் ஆர்டரிஸில், ஏன்னா ஃபேட் அக்குமுலேட் ஆகிறதுனால கிளாட் ஆகிட்டு blood supply affect பண்ணும். செகண்ட் ஒன் இஸ் burst ஆயிரும், தட் blood vessels in brainல வந்து burst ஆகும், அதனால நடக்கிறது hemorrhage stroke சொல்லி பார்த்துருக்கோம். ischemic stroke 80 to 85%, hemorrhagic stroke 15 to 20% நடக்கும். என்னென்ன சிம்டம்ஸ் இது காஸ் பண்ணுது? Then ischemic stroke na aspirin we want to take. Hemorrhage stroke na அதை எடுக்கக்கூடாது. ட்ரீட்மெண்ட்டுக்கு முன்னாடி ப்ளட் ப்ரெஷரு அதெல்லாம் வந்து நார்மல் பண்ணிக்கணும், ட்ரை பண்ணணும். அதில் ரொம்ப ப்ளீடிங் ஹெவியாக இருந்ததுன்னா சர்ஜரி மூலமாக ட்ரைன் ப்ளட்டையும் இந்த இன்ட்ராக்ரேனியல் ப்ரெஷரையும் ரெடியூஸ் பண்ணணும். அப்புறம் ட்ரீட்மெண்ட் எடுக்கணும். என்னென்ன மெத்தட்? ballooning method, stent method, clapping method, and embolism. Thanks for watching.